Memorial Healthcare System says the number of pregnant women experiencing high blood pressure in South Florida is double the national average, especially among black women. NBC6 reporter Amanda Plasencia has the story on what signs and symptoms to look out for.
Preeclampsia can affect women during and after pregnancy, and the life-threatening condition is on the rise here in South Florida. One patient shared her story on how she knew when to take action. 4 months ago, Patricia Hall gave birth to this beautiful baby girl, Davini Rose. But a few days after delivery, she noticed something wasn't right.
72 hours after delivering her was when I went home. My pressure went through the roof. It was 169 over 102. That, from my experience, was not normal.
Patricia had postpartum preeclampsia.
I lay down to take a nap and I felt like the bed was just moving.
So what exactly is preeclampsia?
Preeclampsia is a hypertensive disorder that affects women in pregnancy. It is a disease that can be life-threatening to the mother and to the baby. It can lead to severe disabilities. It can lead to mortality.
Hortense Martin is a nurse manager at Memorial Hospital Miramar Labor and Delivery. She says Patricia isn't alone, as they've seen a rise in preeclampsia patients.
We're seeing in South Florida, we have almost double the amount of preeclampsia patients, or those patients with hypertensive disorders, than in the nation. Currently in our MHS system, we're seeing 9.4% of all of our deliveries are patients with the hypertensive disorder in pregnancy. We do see more incidents in women of color, our black and brown patients.
For Patricia, her cardiologist, Dr. Juan Carlos Brenes, educated her before pregnancy, so she knew what to look for.
I knew it's not normal to feel how I was feeling.
Patricia was away from her baby for 4 days until she was cleared to finally go home. So why are we seeing preeclampsia numbers tick up?
Now we see women who are choosing to have babies later in life. And when you're having babies later in life, you may have other comorbidities that have already started. For instance, hypertension, diabetes, obesity, those sort of things do lead to increased hypertension.
At Memorial, they have a blue wristband that preeclampsia patients can wear so doctors can identify and treat them faster. Some signs to watch out for include sudden swelling, headaches that won't go away, blurred vision, and pain in your upper abdomen. Patricia says she's thankful to be alive as she now enjoys her time with her baby.
I can't stress how important it was that I knew ahead of time so I could pay attention to the signs and came back in early enough to be here now to enjoy 4 beautiful months with my daughter. So that I'm grateful for.
Like Patricia, if you feel that something isn't right, don't ignore it. Get the prenatal care and talk to your doctor. Amanda Plasencia, NBC6 News.